You're watching NBC5, honored with a Diversity Best Practice Award by the National Association of Black Journalists.
Are you tired and run down? Your problem may have a simple solution.
Have your doctor check your vitamin levels. More and more North Texans have a vitamin D deficiency, and doctors say worries about skin cancer keep people out of the sun and covered in lotions. And that prevents your body from making the essential vitamin.
Now, for some people, that can lead to significant health concerns. NBC5's Christy Nelson has tonight's health alert.
After a routine physical at the Cooper Clinic, Kathy Wood discovered a problem she never even knew was possible. Her vitamin D levels were so low, she had to start taking prescription-strength supplements.
I drink a lot of milk, and I thought my vitamin D levels would be fine. I eat a lot of fish.
Now that vitamin D testing is routine at Cooper, they're seeing lots of people like Kathy.
We're finding when we measure thousands of patients, the vast majority of them are low.
Dr. Richard Honecker, a family practice physician, sees the same trends.
It's a sort of epidemic, so to speak. It's not really a disease, but, like an epidemic that you spread, but it's epidemic. Everyone seems to be low.
Vitamin D is also called the sunshine vitamin because sunlight exposure to skin is the best and only natural source for it. It's known to be essential for bone health, but research shows it's also crucial for fighting all kinds of diseases.
If you're low in vitamin D, your immune system does not function as well, and therefore you're more susceptible to infections. There's a greater risk and incidence of heart attacks and strokes in people that are vitamin D deficient versus people who are okay on their vitamin D levels.
Low vitamin D levels are linked to chronic pain, fatigue, depression, osteoporosis, and more.
We work inside, we live inside. If we go outside, we're taught to wear sunscreen because we want to lower the risk of skin cancer, which makes sense. But a sunscreen of SPF 15 or greater blocks 99% of the synthesis of vitamin D.
And darker-skinned people are more at risk. The American Medical Association says nearly all non-Hispanic blacks and most Mexican Americans have insufficient vitamin D levels.
Few foods are either fortified with or naturally contain vitamin D, so sunlight and supplements are key. How much you need depends on you, your health, your weight, your skin color, and even whether or not you use sunblock.
Kathy Wood says she feels healthier since starting vitamin D supplements, which also help her body absorb calcium.
In the last 2 years, I have not had one cold, and I really attribute it to the vitamin D.
Now, does it hurt when I push on your shoulders?
And this patient reports less muscle aches and pain. Doctors say the current recommended daily doses of vitamin D are actually inadequate, and just about everyone should be getting more in one form or another.
I would recommend that every patient, every person in America get their vitamin D checked because there's so many people are low, and the ramifications of having a low vitamin D are so severe.
Christy Nelson, NBC5.
Great information. Many health groups now recommend adults take 1,000 to 2,000 units of vitamin D daily. That is 5 to 10 times the old recommendation. Doctors expect federal guidelines to be revised in the coming years. Most, but not all doctors are now testing for vitamin D levels in routine physicals.
Well, as the